Welcome to the third webinar, guys. We're doing this webinar is all about case studies on pelvic asymmetries. So they're all my own case studies that I have recorded and have personally worked on improving with horses. So thank you so much for joining, and we're going to crack straight on, really. First of all, for those of you that don't know me, hi, I'm Nika. I am now back in the UK. I've been in Dubai for 3 months just to honestly get away from the horrendously cold uh, weather in Britain. But it was really, really nice just to get some sunshine and some consistent sun. And I was very fortunate and grateful to also be treating some horses in Dubai. So some of the case studies I have here are from Dubai, but also from the UK, and they're very recent case studies as well. So if you enjoy it, and we're going to talk about just a bit of an overview from webinar two, because they're all interlinked and they all kind of flow. And then we're going to talk about some of the common causes of pelvic asymmetries. Just going to briefly mention about the research, and then I'm going to talk about a couple of case studies in depth and how we rehab them. And I say we because it's never a single approach, right? It's always a team approach, and it's always a case of working together with other paraprofessionals to ensure that not only can we provide an optimal service, but we can get the horse back into function and optimal function as soon as possible. So please, if you have any questions, just email them through to Nikki. This is a recorded webinar. However, the last webinar will be live, and it'll be an opportunity for you to ask any questions from the last three webinars that we've been doing. So yeah, just to clarify that, the last webinar is in April. I think it's the end of April. Just check with Nikki. But any questions you have, just write them down. Or if you kind of really need to know the answers before then, you can either email Nikki directly or email me at info@animalchiropractoruk.com. Okay, so just to briefly overview and talk about what we spoke about last month, we looked at specific exercises to do with pelvic engagement, improving pelvic engagement in horses. And I myself have found more benefit when, if there has been an injury, A, to obviously get the diagnosis, but B, the rehab and the strengthening exercises need to be, for me, started in the stable. So no rider, no weight on the horse's back, and isometric based stable exercises. Then progressively move that on over a couple of weeks or even a month, depending on what we are trying to improve and strengthen, onto groundwork exercises. And again, for me, I love long lining. But as we work with different owners, we know that owner compliance is key. So there's no point in suggesting and giving a exercise routine for an owner that can't long line, and the same with an owner who can't do corrective in-hand exercises. And because we all know, and we've probably seen, and I used to be like this as well, where I would honestly think that groundwork was just lunging a horse, and that is constant circle work, which we all know most horses don't actually adopt the posture that we are looking for in the optimal function in rehabbing or retraining the body's way of going. So in that case, so constant repetitive circle work can actually be counterproductive to what we are trying to do. So you really have to target and tailor your exercises depending on the owner's A, skills, but B, what facilities they actually have available. But yeah, we just spoke about some groundwork exercises, either from the nose or on the long lines, and then progressively moving up to under saddle. That is before the rider gets on board. So saddle and then the rider. And the key with these exercises from a ridden perspective is not just to straight away go into trot, walk, trot, canter, but actually to work on the foundations of the walk. So that, for me, we spoke about the principles of training, and that would be incorporating things like balance, the rhythm, the consistency. If you missed that, look back at what we talked. Well, what I spoke about with the scales of training, but progressively, introducing the different levels of the scales, but focusing on smaller things like transitions. Circles are really beneficial for improving hind limb engagement. Depending on the size, you can vary the rhythm. Again, you can vary the area of where you're doing the circle. So flat terrain, increased terrain, grass versus hard ground. Like there's so many different varieties that we can do with just a simple circle that can have significantly positive or detrimental, but effects on the hind limb engagement of our horse, of the horse that we're trying to strengthen, rehab, etc. And all of the above, the stable, the groundwork, the written exercise, very much does depend though on what the goal is. So what's your goal for that horse? What is your goal? That needs to be crystal clear so that you can then provide the appropriate exercises for that horse or for that owner, rider, horse combination. I did speak about this in the last webinar and webinar one, but why this topic? And I found and have been finding that hind limb engagement is actually poorly understood. It's commonly thought of as a distal limb issue, so either like stifle hock, fetlock, hoof suspensory issue. And hopefully from webinar 1 and 2, we have a bit of a better understanding of the different levers more from a soft tissue perspective and how these different levers are responsible for generating the hind limb push, the hind limb power that we're all seeking as riders, but we're also listening on how owners say what they want, like what are their desires with their horse. We definitely we spoke about specific joints of the pelvic girdle, but without ignoring the distal limb. But yeah, just in general, I don't know if you guys find the same thing. I often find that there is a big kind of disconnect with the desire, but actually understanding that desire. So common diagnosis of poor engagement in horses is so often categorized into distal limb issue. So, oh, it's the hocks, just, you just inject the hocks and move on. But it's almost, we can't really accept that description anymore because we know that the muscular ligamentous connections of the hock stifle, coxofemoral joint, lumbosacral joint, the intervertebral joint. So there's so many compartments that we have to understand before we can really improve hind limb engagement. We also briefly spoke about in the last webinar on the causes of pelvic asymmetry in horses. And the key thing that we need to do, and I'm sure we all do anyway, is we are ruling out pain for any kind of pathology, because you can be prescribing and suggesting many different forms of exercises to strengthen the pelvis. However, if there is an underlying pain there affecting the movement pattern, affecting the nerve endings, then you're almost not only wasting your time, but you could be creating a bigger problem by asking a horse to, say, take a little bit more to strengthen, take more weight on one hind limb that you visually appear to see as a weaker limb. And again, that is our subjective assessment, which we have to take responsibility for. It's our subjective assessment. You could actually be creating a more negative movement pattern through the body by not understanding and ruling out pain first. So that's why I have put that in red and kind of highlighted that. The other thing I also consider and really reflect on when looking at pelvic issues in horses and hind limb engagement is understanding the reciprocal and stay apparatuses in their systems, and if we have got an issue with a suspensory or a hock or a fetlock or something in the carpus, then what is that actually having on these these adaptive systems that horses have, which are there for, yes, many years for a survival and for a survival purpose, but they also utilize these apparatus in function, so in during movement, but also in the stable for rest and digest and things like that. So we need to, I always think when looking at pelvic push issues, is understanding and referencing these two systems in particular to better understand what's going on. And we also discussed and looked in the last webinar at areas of pelvic asymmetry causes, and that would be, so for example, the lumbosacral joint and the soft tissue attachments to this lumbar-sacral joint. I went into a bit of a detail about the iliopsoas, psoas major, minor, and their and iliacus, and that their function and primary key role in flexion of the hind limb. And we also looked at the femoral and caudal muscles of the hind leg, and also how important they are in generating pelvic hind limb engagement, but also if they are injured, what effect they're going to have on the ability of the horse to flex their pelvis, tilt their pelvis, and also create the sit effect that we're looking for onto the hindquarters to generate a push. Also, last time spoke about the importance of head and neck positioning, such a key role on the effect and function of the lumbosacral junction, and sometimes where we have previously heard or suggested that horses should work long and low, but actually if there is an injury and an undiagnosed pathology in the pelvic girdle, is this then correct to suggest a long and low? Because are we, when the head and neck positioning is in that long and low position, is it having a negative effect on the function of the lumbosacral junction and almost not allowing any stability in that area? I also mentioned the importance of the hip joint, so the coxofemoral joint, and its soft tissue attachments and their function in pelvic and hind limb engagement. And yeah, just to briefly talk about the research I mentioned in the last webinar about exercises that are currently out there for, and this is research and scientific papers on pelvic exercises. They were all from the Equine Veterinary Journal of Science, so they're all peer reviewed. And I also just need to stress that, remember, this is my interpretation of these research studies, and I'm by no means, I would never admit to being 100% right. So it's my interpretation. So you might read and interpret the journal completely different. And I've heard this saying before, where take my information and take anyone's information like you're eating spare ribs. So you when you're eating ribs, you kind of enjoy some bits, get value from that, and then you kind of like dispose of the rest, or you just move the rest to the side. And that's quite a different analogy, but that's almost the same with any kind of information that you take on board. Is take what's relevant to you, research that, like understand that point better, agree, disagree with it, and then the rest of it you either leave or come back to a different stage, because we all obtain and take in information depending on where we are and what we're currently working on and going through. So yeah, I just wanted to clarify that. So all the studies from the last webinar were from the Journal of Equine Veterinary Science, and I have said to Nikki that I will do a list of all those journals as well, so that you can have a copy and go and read them in more detail for yourselves. So moving on to the case studies now, just to reiterate, when it comes to case studies, I don't know about you guys, but I always find, well, especially nowadays, having done this job for a few years now, I always ask myself before I treat, is to treat or not to treat. To treat or not to treat, that is the question. And it's just something that I'm realizing more and more. On these two case studies, I will show you um, where this question I have has really helped me a lot. And in one case study as well, it really didn't go to plan. So I always ask this question now: to treat or not to treat. And sometimes less is sometimes more. So just before we start, just a general warning that obviously these are my own case studies and images. Please don't copy. This is my owners and their prized possessions. So it's obviously what I'm sharing with you today, but it's only for the purpose of this webinar, not to be replicated. So please, and also at the same time, remember that this worked for these horses. It might not work for every single horse. I'm sure you guys know that, but just had to put that out there. Okay, so the first horse I'm going to talk about, he's called Rod, and we used to call him Rod the Sod. He wasn't a bad horse, he just had a really interesting personality. And I treated him, he was based in the UK, very good eventing background, very, very well bred. And he came to a very nice owner of mine to basically do whatever we wanted with him because he was not performing. Basically, his symptoms and his behavior was refusing to jump, knocking fences, struggling to, in their words, build the top line, and a very inconsistent contact. So this was the initial outreach I got. I got a phone call to say, "Can you come treat him? He's here because we have no idea what to do with him. He's been looked at by different physiotherapists, chiropractors, osteos, and they're ridden by a very well respected trained rider and trained well, but he's just not performing. So it's either you sort him out or he's basically going to be retired, or that'll be the end of his career overall. But it's a shame because he's only 6 years old. So that's a bit of the kind of like history I got when I first met him. When I did the initial assessment of him, very big, long, lanky horse. I don't know if you guys are seeing this more and more, but I certainly am, where we seem to be breeding bigger horses for these lovely expressive movements, like natural scope, natural athleticism at very young ages. However, if you break down this athleticism, there's actually no strength, there's no stability of major leverage points. And in my opinion, that would be the pelvic girdle, the shoulder girdle. There's absolutely no stability in these areas to provide correct development and not only skeletal maturity, but provide correct strength through their back. And anyway, so yeah, he didn't have awful conformation at all. It's just like long and leggy and very, very weak. For an eventer that competing at quite a high level, I was quite taken back at how poor his posture was. And again, posture is subjective, right? We all have a slightly different opinion on what posture should be for what discipline we're in. But for this eventing type, I was taken back at how weak his core was for a horse competing at this level. His foot balance was incorrect. He was shot all around, but just totally, again, out of the 4 feet, maybe there was not one pair front or back that just looked right and was loading correctly. The other thing that I found really sad when I was with him was I was so busy. So I know he was only 6 years old, but constantly like mouthing, and he would bite. That's why he was called a sod. Like he would get to a point where he would bite, but it wasn't like a bite when we asked him to do anything. I honestly felt this horse was in a low form of chronic pain and had learned to adapt these new behaviors to kind of just help him through it. And that's what really, for me, actually broke my heart a little bit. And it was really sad to see because I think for a horse to get to that stage and adopt these new patterns, which are now behaviors which are now assumed as normal, but they're not normal. And as we uncovered his issue, it's interesting how these behaviors suddenly dissipated. The most significant thing about Rod was initial assessment was from behind, he had a significant pelvic rotation to the left, but more so than anything, the tuber sacrale was extremely asymmetric, so dorsal right and cranial right as well. And this is what initially, despite everything else, even though we do the full assessment and we ask all the history, that was glaringly obvious to, okay, so before I even treated and addressed anything else like the foot balance, the question I asked was, what has happened behind? And the reason I put you about speaking up is because this horse came to us from his owner was the mother of a very good sports vet. So it was a little bit like, okay, surely this horse has been seen by the vet. And when I spoke to the owner and the vet, this was the case. He had already been seen by the vet only 2 weeks before he arrived at the yard that I went to see him at. So I've put the elephant in the corner. I've not gone crazy. I know we're not talking about elephants, but I put the elephant there because I was a little bit like, so why is no one talking about the asymmetry? And I just wanted to put that out there is that sometimes you have to speak up and don't ignore the elephant in the room that almost everyone is, where it's, I think what tends to happen is when a horse has this posture and this asymmetry, and he has been looked at by the vet and the vet's gone, oh, it's fine, then it's almost assumed like because the vet said it's fine, it must be okay and everything must be fine, so just treat the horse. But sometimes you have to speak up and state the obvious. And when you start asking questions like that, the path starts to unfold, which might in the short term seem long and tedious, but actually in the long term will get you the result a hell of a lot quicker. And I'm sure you've all known this, but there's always a story, right? There's always a reason that there is this asymmetry that we're seeing. And I feel like it's my responsibility to figure that out before just treating. And that's why I asked that initial question of to treat or not to treat, because sometimes we're almost investigators as opposed to just come in, do the job and go. So we decided, because I wasn't happy to just treat, we decided to get a full team approach. And luckily the owner was really on board for this as well. So I love this photo. I don't know if you guys can resonate with this, but like the vet, the trainer, the vet nurse was there, the handler, because remember he was not at the event yard anymore, he was at a completely different yard. So the handler was the lady in the blue, and the owner came, myself. The only person that was missing was the farrier. But for me, like this a team approach when assessing a horse is not something that I get to do all the time, but it's definitely becoming more and more apparent, I suppose because I am being more persistent with wanting to be in this environment. And it makes such a big difference because I don't know about you, but when you are one on one with an owner, especially when I find this, but you're fairly like confident in what you're saying because we're taught a certain pattern of recognizing asymmetries. However, when you're talking to the owner, you're very confident, you're very assured, and have reasoning. But I do find when you have a different environment with this team approach, how the questioning and your ability to answer shifts because you're very then aware of people with different niche, different expertise coming together that are all looking at the horse slightly differently. And it makes, in the beginning, makes you feel a bit uncomfortable, but actually in a good way because it makes you second guess what you're saying and also have a bit more justification of what you're saying. So yeah, this was great because all these people that did come together, there was no well, this is what's happened, this must be the fact. It was very much like it could be this, and what are you seeing here, and this is what I'm seeing, and that kind of like no ego environment, I think is what like the magic really happens there. So anyway, we came together, we looked at the feet, looked at absolutely everything on the hard ground, soft ground, lunged. The only thing we didn't do was put the rider on. But this meant that we could get a diagnosis and a intervention before moving forward. So on the assessment, the elephant in the room was spoken about, which was, why has this asymmetry been there? The owner confirmed that it's been there for 2 years. 2 years, 2 years of moving like this. It just shows you why there were so many compensatory issues and why the foot balance didn't look right, why his behavior was probably at the point of refusing to jump. It was a chronic issue. So yeah, what we looked at, we scanned stifles, we scanned the hocks, we scanned the fetlocks, and nothing significant came up on any of the findings. However, when we watched him move, there was a consensus, and we all agreed that there was not a significant, but definitely a shortness in the left hind flexion and extension. And given what we just previously spoken about in the last two webinars, the surrounding soft tissue attachments palpably were very different right to the left hind. And from my perspective, that made sense. He didn't have bad engagement. However, with refusing to jump, plus the behaviors he was showing around the saddle, he was clearly in discomfort. And when we looked at the sacroiliac joint in more detail, we identified that through ultrasound that there was injury to the dorsal sacroiliac ligament. Let me get that right. The dorsal sacroiliac ligament. So when this happens, I always think, right, first of all, what's the function of the SI, right? Because many owners, including myself, used to think that the SI was part of hind limb engagement. And as we've looked at, and I've been to the last two webinars, the SI, it has some effect on engagement, but it's not the reason your horse has poor engagement, in my opinion. The SI joint itself is there as a shearing joint. So it's not like a flexion extension joint, it's a shearing joint. And that shearing joint has a massive role in stability. So basically a large part in supporting the weight of the horse's trunk, the abdominal, and this is key, in absorbing shock. And that is probably why he was refusing to jump, because he didn't have the stability to sit back on his pelvis and push from that shearing force sacroiliac joint, not a flexion extension pelvic engagement issue. I hope that makes sense in what I'm saying. Function of the SI ligament is also a good thing that we need to talk about and address, because before we can sort an issue out, we need to understand the form and the function. So the SI dorsal sacroiliac ligament serves a major role in weight and force transfer from the hind leg and the vertebral column, which will affect the stance phase of the stride. So this is probably why he looked a little bit lame on the left hind, was because he didn't have the stability on that left hind through the dorsal sacroiliac ligament of the SI joint to stabilize and push in the stance phase off that left hind, which is why he probably looked a little bit lame, especially on the right rein on the lunge, but also on the hard ground. So when we scanned the ligament, it was fascinating, and I love this way of diagnosing, because you're there, so you can see it black and white, and you also get the true picture. But yeah, first of all, we need to understand that. So a ligament strain can happen either from repetitive strain or from a direct trauma. And I'm going to go to the cause for this horse in a minute. But first of all, I always like to think about it. Let's break it down simply. What does a ligament do? A ligament connects two bones together. It's strong, quite firm attachment. It's almost like bands of rope, and they help to stabilize a joint by holding two bones together. So that once I have that understanding, I'm like, right, so what did his ultrasound show? His ultrasound showed that those ligament ropes were those bands of rope were like zigzagged. So there wasn't like a tear or a hole, but they're definitely being strained 100%. And that was enough over time in this long leggy horse to show significant changes in his behavior. So before again, like the vet was treating and we were all talking, I kept coming back to this question of like, but why? What was the cause? And then I don't know if you have been in a situation, but finally the owner goes, "Oh, he did out at a competition where he was refusing to jump, so the rider was putting more pressure on him, and he got to a stage where he flipped over backwards. You know, when you're like, why didn't you tell me this in the beginning?" And I'm sure you've all had this situation and been in this position before when it's so freaking frustrating, right? Because you're just like, I wish I knew that in the beginning. But yeah, it did make a lot of sense. And I'm glad we finally understood it because this was probably a combination of a repetitive strain, but more so from a trauma that was very overlooked in initial stages because I think a combination of things. A young horse, adrenaline had kicked in. He was at a show. They flip over, they then get up and they trot them up and they look fine, right? But we all know that that is a significant amount of weight force going through a shear forcing joint, and this is what happens. So, um, yeah, I know sometimes I don't want to get like uh, focused on, the frustration of why no one was honest. But I think, and I believe this happens a lot in the equestrian industry, where you just have to keep questioning because the cause eventually comes out if it's not like a conformational cause or like an injury in the field or something like that. So yeah, we had a trauma. So once we had the diagnosis, we did intervention with medication, and then the fun began because this is how we rehabbed. Um, in the beginning, we went back to pure stable based exercises, and again from webinar two, like this is not complicated. He was turned out during the day, so he did have access to a field. He was alone in the field. The terrain was flat and grass. But yeah, so turn out and we did 3 weeks of pure stable based exercises only. And then we did a combination of laser. So I've got a class 3 laser. We did laser along the paraspinal musculature. We did laser 2 times a week for the 3 weeks. And then once we were happy with the reactivity on like a palpation level through his back, through his hindquarters, we then went on to doing some groundwork exercises. And this is where we utilized taping. I don't know if those of you have ever used taping, but it has loads of benefits and also some cons. The most frustrating thing is that it's just I suppose it's the application of the tape, but also the hair. So this was coming into winter time, so he was growing a coat, and that didn't mean that meant the tape didn't stay on for very long. Plus, he didn't really have a lot of patience. So we we utilized the tape when we did the groundwork, and then the tape would almost stay on for a few hours, and then it would start to fall off. So we would take it off. But actually, we found it quite interesting to see the changes. They were subtle, but enough just with taping alone, doing the in-hand work. From a chiropractic perspective, I never did a full treatment on him. I actually never adjusted his pelvis. Um, in during the first, I think it was 6 weeks, I did not do anything to his pelvis. I did do some mobilizations throughout the rest of the body, but more so through the cervicals and early, so through the shoulder girdle itself, rib cage, but nothing through the pelvis. We also did some sensory stimulation, and this was the utilization of like a chain on the left hind. We didn't introduce this until week 5 or week 6. I have it written down here. And we did this very gradually, just for 2 or 3 minutes at the start of a session to improve and not really improve, but just work on the range of motion of the left hind, because there was a difference in the mechanics of the left hind compared to the right. So yeah, we did utilize that, not for very long though. And then this is actually like I learned a lot of lessons from this horse, because he did. I was going to press pause there, because we did have to adapt a lot of our groundwork, and this is key when you're giving any form of rehabilitation program that you're not there. Is this owner was trained in a style called Pirelli, and Pirelli I'm not for or against, but there's a certain way that they train and ask the horses to do these exercises that they do them in games, and some of the game exercises, which is a form of groundwork, was just too much for this horse. And also these ropes. So I don't know if you can see that in the top right hand picture, but they work in these head collars, horsemanship head collars with different pressure points. And because this horse had adapted this form of behavior through his mouth, where he would constantly be chewing and mouthing and like biting, very busy, what tended to happen with his groundwork was he'd bite the rope the whole time. And even though these pressure halters apply and are used as they apply a little bit of pressure to lower the head and neck, which is going to have an effect on the spinal flexion, it for this horse was counterproductive. So we actually moved on to a cavesson instead, where the pressure was from the nose as opposed to here, which honestly for this horse and this owner was a game changer, because he went from biting, mouthing, being even more inconsistent in the contact, to starting to settle in his neck and his mouth, which had a really big effect on his work and his concentration level. And I also think that he was in less pain, so we could probably put that down to two things as well. So yeah, training aids, gadgets. We use no lunging in terms of German aids or Pessoas, nothing like that was used. It was all from the either a rope halter here or just the cavesson and a rope. And we utilized, first it was like a big pen, so probably about bigger than a 20-meter circle, that we just did a lot of walking and changing of rein and small circles, but everything was done very slow in the walk. And then we actually progressed to different terrains. So we moved from obviously arena to different grass. So I know this might be a bit different, but we had like a flat grass surface, and then we progressed to just a bit more of a softer surface. And we actually then also did some stability exercises on a pallet, which for this horse was really, really beneficial. And he found it so hard, which was again shocking, because for a horse that's done high level eventing, you'd think they would have quite a good core foundation. And honestly, he didn't. So it was almost like, despite having this injury, we had to go back to basics. We had to teach his postural muscles strength, stability. And it was almost, I felt like we were helping his body from the inside out, because visually over time, the muscle, so the cranial femoral muscles probably were much better to on palpation. They were not reactive anymore. But obviously the ventral muscle atrophy on the left side, because of the tuberosacral asymmetry, was improving so much more. And by the way, we were just walking. There was no trotting yet, there was no cantering. Just going to put in there, because we did also have the teeth done. They weren't horrendous, but there were some sharp edges. And we did also take his shoes off at one point as well, because he wasn't doing road work. And because, in all honesty, some weeks he looked, the gait pattern changed so much. There was no consistent routine every week with his gait. Some days he looked worse on the left rein, on the left hind. Some days he looked better on the left and then worse on the right hind. So it never ever changed. And um, taking his shoes off was probably a good thing for this horse because he allowed then, because of the different loading pattern higher up, his foot balance completely changed to suit what was going up in his body. But over time, actually, they naturally leveled themselves out because his body moved totally different. Saddle fitting as well, I need to speak about that, is we did after the groundwork progressed to having the saddle on before the rider for a few weeks. And we did just start with almost like a racing pad, just something flat, and honestly treated him like he was a yearling. So he was a bit like, why are you guys getting on so slow? But it was interesting again when we got him, and I actually did have the chance to ride him for an eventer. His aids, the basic foundation aids of forward and pressure off of your leg was just not there. It was like riding a backward baby. But yeah, we did take this time. We did take time with this, and I want to say by about week 12, we were trotting, so with and without the rider on the long lines, and we then progressed to hacking. Um, for for him, obviously arena work is beneficial, but I do believe that hacking, and there's only so much hacking we could do in the long lines because of the arena, the area we were at. We just had to get the rider on in that stage and get him walk hacking. We did still do the in-hand groundwork in between the hacking sessions in a week, and it honestly, it was a lovely case study because not only was there a great team approach. But yeah, it was an opportunity for us to kind of play a little bit with different modalities like sensory stimulation, taping, and terrain exercises. So these are these balance exercises. And this is where he is at today. It's just so nice to see because this horse really struggled, obviously, with his jumping altogether. And for him to stop is quite sad, but it's just nice to see him now with the rider on and doing what he was bred to do. I love seeing the video here because his obviously changing lead quite nicely. And yeah, you can see the ears are pricked. He absolutely loves his eventing, so loves his jumping. So it was really nice to see. Um, this is the end of this case study. Any questions you have, let me know. Write them down, and we can always talk about the case study next month if you want to have any, if you have any questions about that case study. But I'm actually just going to go on to the next one. I'm a bit wary of time. I may be going too long here. um, this is the next one. So this is Ronnie. She's a 6-year-old a mare, extremely well bred for show jumping, very, very good breeding. Um, and when I first met her, um, she was struggling to bend. So heavy on the left rein. That was the first thing the rider told me. She was like, she is awful in the left rein for a young horse. And what she also said, which really fascinated me, was she would get her into work and jumping, say 1 meter 20, 1 meter 30, and she would always reach a point where she would jump for about 3 or 4 weeks, jump well, go out competing, and then just go downhill very quickly and go lame. And they said it was like this pattern that they've had with her over the last kind of 6 months. Um, the other thing during the training was she's very lazy, lacking motivation, but like a really kind person. I don't know if you can tell here because she's got such a nice eye. She was so sweet for this very big, again, big mare. These big horses people are breeding nowadays. It's fine, but I do think we need to be very aware of the training that goes in before these horses are competing. Yeah, she's so kind. Um, so with her, I'll just press that pause for a second. The most significant area of her body that I was drawn to, and obviously there's so many because we do obviously treat and assess holistically. for a big mare competing at this level, she was so weak in her pelvis, very weak lumbar region. And for like this quite big shoulder girdle, big trunk, she just had very um weak visual, so obviously superficial, but apparent, um also apparent deep weakness through her pelvic girdle. So she had great engagement, um, but very, very weak. And then obviously fine in the walk, but the minute you trot or canter her, and as the rider said, just no push, just absolutely no motivation, and almost like it's an effort to be exercised. Um, I just had a video of the rein back because obviously every owner has their style and way of reining back. But I just find it fascinating how she reined back because for me this is an awful way to rein back. There's a lot going on there. We'll just do it one more time. So obviously you all have your different ways of assessing correct rein back, incorrect rein back. Uh, but for me, you can definitely see the lameness, but also the dysfunction in the stability of the key areas that help with pelvic engagement, which is the lumbosacral joint, the coxofemoral joint, the cranial femoral muscles, but also the intervertebral discs, especially in the lumbar and late thoracic region. Another thing we need to can't ignore here is she's so on her forehand. She has very, very limited to no flexion in the stifle uh, and the hip joint, the coxofemoral joint, when she's reining back. She's toe dragging, which is any wonder why you then ask her to go forward, why she is why the rider's feeling the symptoms she's feeling. The most significant thing with her that I saw on assessment was, again, pelvic asymmetry. That's obviously why we're talking and sharing these case studies today, but a significant rotation to the right, ventral rotation, and the difference in her caudal femoral muscle development was so apparent and shocking that I was thinking, so how does this mare even jump? Like, how does she do the job she's doing? Obviously, she wasn't because she gets into this pattern of working so well for so long and then goes lame. So this was a mare where I genuinely asked myself that question of, do I treat this pelvis? Because there's so much muscle asymmetry here. Is there a reason? Um, the owner was adamant. She was like, "No, we'll be fine. You know, the vet's got permission. We'll treat." I did do an adjustment, very very minor though. Adapted it to her weakness. I did the adjustment through her pelvis. I also did some chiropractic through her left lower cervicals. The shoulder girdle was completely out of alignment with a forward tilt to the left shoulder, which could be compensatory from the right hind. And then also her spine, so the mid thoracic region, there was just such limited function in this area, but also from the associated muscles that it was just, yeah, I did treat, but was very wary. Um, and she was fine after treatment. She, I just kept her in walk, gave the owner some exercises, and 10 days later, this happened. It's just one of those like, oh crap moments, right? Not an ideal situation. Very, very lame. Lame right for, as I'm sure we can all see. So what do we do? Um, we obviously got the vet involved. The vet was on site. We did a nerve block from the foot up, and she was improved when we nerve blocked the suspensory ligament. So right fore suspensory ligament, medial and lateral branches, after ultrasound showed that there was some inflammation. But definitely one of those like, oh crap moments. And my question was, did I do too much? Did I treat too much for my body that was really quite asymmetric? So after like trying to not panic too much, I went back to my anatomy knowledge and thinking, right, well, what does the suspensory do? The suspensory on the front and hind feet runs from the back of the cannon, so the back of the calf, the back of the hock, down between the splint bones, beneath the two flexor tendons, before dividing into two branches and insert onto the small bones, the sesamoid bones, behind the fetlock joint. The main function of the of the suspensory ligament is to prevent excessive extension of the fetlock, and the two branches, so where it like splits, helps with stability and has a key role in the stay apparatus of the front leg on the whole. So that's first of all the function. Now I understand the function. I was like, right, why did this horse now go lame 10 days after treatment? And this significantly lame. Like the owner said, this is the most lame she's been. Was it that by helping, obviously my job to help the body improve the range of motion, did we then did the horse then shift excess force through the front end because the back end was moving totally different? You can probably scratch your head and say, yes, that's it. And as humans, we always seek an answer, right? You always need to know. But also you could counter argue that and say, was she now moving better than it actually brought out the primary issue, which they couldn't find for a while? You don't know. What we did is we got the farrier involved, and he changed the foot balance, because on a right circle, and it's interesting, this links very much to what she was saying from a written perspective, heavy in the left rein. On a right bend, she would load lateral medial on that right fore very excessively. So we adapted the shoeing, and this farrier was honestly one of the best farriers I've ever seen in my life. He was just a magic man. A lot of respect for him. Really, really. I would love him to come to the UK. But he created a shoe that helped with the force absorption of the loading of that suspensory branch, medial and lateral. And she was about 50% more sound the next day. So we didn't go back to riding, but we did do some rehab. So what did we rehab? We were doing laser and shockwave on the branches of the suspensory. She did have some time to rest because the shoeing did change the loading pattern of the front feet, as I've just described. We did do some of the stable base exercises that I did show you in the pro webinar too. We did this for a couple of weeks. I didn't do any form of chiropractic through her pelvis. Again, didn't have to do any of that. The actual asymmetry wasn't as bad. It's just obviously the cranial and femoral muscles, caudal muscles, were constantly shifting. So one week they would be tight, one week they would be really soft and supple. And I think that goes hand in hand with the body's changing its loading and its movement. So you're going to have different areas of tension and shifting, which I think is a good thing. She actually did do some swimming as well. Well, I've got a video of her doing that. But what seemed to really, really work for this mare was, again, going back to the exercises to help with postural stability, because, again, for such a big, powerful horse, the foundations of strength were not there. So that really, really helped with her. And this is her swimming. She went swimming, I think it was, I've got it down here, 2 times per week for 3 weeks. Obviously, the benefits of swimming being non-weight bearing, which which is also complementary and helps to adapt to the shoeing. But she was also like quite a good swimmer. I don't know if you guys have seen many horses swim, but they can you can have different types of swimmers like humans, and some horses are just not very natural in the pool. I'm not saying she's the best, but she swam well, and it definitely helped with her fitness because the owner didn't want her to lose too much fitness because she wanted her back competing. So she's a competition horse, and the swimming really helped from a cardiovascular perspective as well. Um, Bless her. So yeah, this was her swimming. Um, what did I learn from this? And definitely a learning because I'm not gonna lie, my confidence was definitely a little bit shot when I saw her lame. I thought, oh my God, what have I done? Like, there's no playbook on this. How can I sort this out? It's life, it happens, and that's when you just have to really trust the process, but work with your team. And the key thing here that I learned was the value of teamwork, owner compliance. Because, so for example, compared to the first horse to this horse, the first horse I dealt with the SI injury had time. This horse, we didn't have time. We had goals to hit because of the season that they were in, and we had to almost be very time efficient and monitor her week by week to see the progress because of the time. And I also just put your self belief because when you think your treatment's done something, for me, it totally rocked my kind of confidence there. I was like, oh my gosh, what have I done? Um, but it did teach me to lower my expectations a bit and not lower your expectations and also trust the process because it's a body and you're not always too sure how it's going to adapt and respond to a treatment. Just to show you where she's now, she is back show jumping, and yeah, she's looking very happy with herself. The other thing about this horse is, yes, she's back jumping. However, the muscle will the muscle, there's more than one. The pelvic asymmetry in this issue, in this stance, in this situation will take time. Um, what would I have done differently? So easy to think back and say, oh, maybe have not have treated this horse's pelvis and done probably more through her spine. But at the same time, maybe if we'd only done that, we wouldn't have eventually come to the cause, which even though there was a suspensory issue, was only inflammation. So there was no tear or there was no hole. It was inflammation from a loading issue. So in a way, probably not anything differently. Um, the future of this mare would be when she stops her season for show jumping, is to intervene with a more intensive stability program for um to encourage better muscle asymmetry behind, but also see if the loading pattern in front changes to a point where she can go back into normal shoes. I also, this is just me slightly off piste here, but I don't know what you guys think. I find with these young horses and mares as well, with only being 6 and doing the level they are doing, are they fully mature to be doing the work level? And if they aren't, and in this case, potentially she wasn't, is that enough just to also create these weaknesses and asymmetries and lamenesses? Because the body is still changing. Growth pains in horses, they happen in humans. Why wouldn't they happen in our competition horses? And it does make me think that time, and time to allow these horses to mature and grow into their skeleton with a supportive, stable based groundwork program, would we see less of these inflammation of ligaments, repetitive injuries in ligaments? It's just a thought. I'd love to know your ideas as well. Um, But yeah, that's it for the webinar. Thank you so much for joining. I hope I haven't rambled on too much. Any questions you have, though, please email them through. And I look forward to seeing you guys next month for the live webinar. Have an awesome rest of your week.